Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 10 minutes past 8 o'clock. It is Wednesday morning, the 10th day of September, 2025. Good morning, everybody. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air right here in San Juan County, New Mexico. If you're listening to my voice in Durango, Colorado, your radio is tuned to 103.3 FM. And if you're hearing me anywhere else on the planet, you've probably gone to our website to listen. That's ksje.com, or you're using the new KSJE app. But glad that you are with us. Welcome also to our viewers who are also joining us this morning, because the video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everybody. So glad that you're all with us this morning, because coming up, our guest from San Juan Regional Medical Center. Stay tuned for that, talking about healthcare and some unique programs at the hospital. So stay tuned. That conversation begins in the next few moments right here on KSJE. Then later on this hour, we'll be joined by a member of the Daughters of the American Revolution, the DAR, talking about a special event coming up to celebrate the U.S. Constitution. That is coming your way today, 8:50 a.m. We'll share details about that. Mick Hess is standing by to take us roving with the arts, our weekday classical music program that begins next hour after the news at 9:06, a special 90-minute version of the program on Wednesdays, because that takes us to Right on Four Corners at 10:30, our local and regional author program. Delcherie Gladden is speaking with author Emily Jones this week about her book called Nahia, I believe is how you would pronounce that, but I could be wrong. But you'll find out more about the book coming up at 10:30 on KSJE. Also, we want to remind you that you can connect with us on other social media platforms like Instagram, like Blue Sky, and like X. And if you're a podcast listener, you can subscribe for free and check out KSJE podcasts, maybe discover a new local program that you may have missed. And the KSJE app, now available for download, KSJE Radio, available on the App Store or on Google Play. You can stay connected on the go. So check it out and stay with us when you're roaming around with your mobile device. Outside our studios here at San Juan College, it is currently 66 degrees at the moment. We're expecting, a cloudy day today with about a 50% chance of showers today. The high 83 in Farmington, another 50% chance of showers overnight, and tomorrow with a high of 81 on Thursday. Chances for rain go up on Friday to 70% and cooler temperatures with a high of 72 on Friday. And then things kind of clear up for the weekend. Partly sunny skies on Saturday, sunshine on Sunday with highs in the mid-70s. I'll be back with my guest with more right after this on KSJE. KSJE is supported by San Juan Regional Medical Center, whose vision is to deliver world-class care, making life better for the communities they are privileged to serve. Offering a comprehensive range of inpatient, outpatient, and emergency care services so residents can live life better here. San Juan Regional Medical Center, community-owned and operated, here for you.
Celebrate KSJE's 35th anniversary on Friday, September 12th at San Juan College. Enjoy Ballets with a Twist, the show that mixes the glamour of Hollywood with the excitement of modern dance. Tickets are free to celebrate KSJE, but you need to reserve your seat. Go online at sanjuancollege.edu. The show starts at 7 p.m. on Friday, September 12th at the Henderson Performance Hall at San Juan College.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
My guest on the program today from San Juan Regional Medical Center, Maranda Marquez, is here to talk to us a little bit about the work that she is doing as part of the Vascular Access Team. She's actually the coordinator of that team at San Juan Regional Medical Center. Good morning.
Morning.
Thank you for being here.
Thank you.
Good to have you back and to talk about the work that you were doing. And this was an idea, this Vascular Access Team was an idea that you had, right?
It was, yes. So I've worked at the hospital for about 20 years now, and mostly in the emergency room. And of course, when you come into the emergency room, you're most likely going to get an IV to help you out. And I just, ever since I went through nursing school, I really wanted to give the best care, and I worked in pediatrics. And when people come into the hospital, that's probably one of the most invasive things we do. You get poked with a needle, and we wanted the experience to be a lot better. So having a very specialized team to do that for you, you know, to get the poke on the very first time, to give you the best care, the meds you need, was really a passion of mine to really go through and wanted to give that best care to our patients and our community. So,
gotcha.
Yeah.
That's where the idea came from, right?
Absolutely, yes.
And so you came up with this idea, and then I guess as it happens, what's the step? I guess there's a series of steps. Then you proposed it to maybe your supervisor?
It was a process, and I had a lot of advocates on my side. I had some physicians that really, you know, pushed it, as well as some nurse leaders that really supported it. And overall, it's better to give the patient a best experience, right? We want them to come in, have the right line, the appropriate line that's going to give them the best care and everything they need. So that's kind of how it came about, and it was a long process of really, you know, trying to speak to advocating for our patients, advocating for those compromised people, those people with cancer, the pediatric patients who are we call them divas, difficult IV accesses.
Okay. Nothing about their personality.
No,
this is all physical.
Yes.
Right? I understand. Okay.
So it's just an acronym of DIVA. So any divas that would come into the hospital, we would want to, you know, that were a difficult IV access, that, you know, maybe have been poked before and had bad experiences. We want to give them the better experience of that first poke, getting a good IV in them, because IVs are imperative to the treatment that we give. So,
right. Once you get that poke in, as you say, right, then it can be used for a lot of different things, whether it's just saline or medicine or what have you, right? But that's kind of the gateway to administer a lot of these drugs or whatever the patient might need. And so is this just in the emergency department, or is it now all over hospital-wide?
It's all over the hospital. I mean, 90% of hospitalized patients do need IV access.
Sure.
So we kind of found that. And even about 5 to 15% need more advanced lines, which is like a central line.
Right.
So we really wanted to give the best care. And whenever you're poking somebody, you can introduce infection, right? So really giving the best standards and not having any of those things happen in our hospital is really what we want. We don't want to do any harm to people. And I know people will say, oh, it's a poke. It's a little bit of harm, yes, but we don't want to introduce additional harm. So having all these kind of anti-infection guidelines in place, really giving them the best chance to have that good experience. I mean, kids come in and anybody comes in. I joke that nobody likes needles, right? Nobody likes to have vascular access or a needle inserted. However, that's how we give a lot of our care.
Yeah.
So giving them a better experience, getting them less pokes, you know, having more satisfaction, having less discomfort is all what it's about. And that's what our team really is focused around.
Got you. And so with this team then, there's additional training, I guess, or how does one become a member of this team? It seems somewhat,
we're very exclusive.
somewhat specialized, right? Well, how does that? It's not just anybody, though, right?
It's true, absolutely. So my team consists of all nurses. So we're all nurses. So we started, you know, we already had a basic concept of how to do IVs and additional vascular access things, but they go through some training where we learn ultrasound. So everybody thinks ultrasound's just for looking at babies and stuff like that, but our ultrasound also, when it's placed on the arm, you can see all the vessels, you can see all the nerves, you can see the veins, you can see the arteries, all these things, which makes it way easier to access a vein
Sure.
than just a blind stick.
Got
so
you.
we always joke that we kind of cheat, but now
Not necessarily. You're using the tools you have.
Exactly. Technology is
Right.
amazing, right?
Now, is that for every patient or just those divas you were telling us about?
So now if they know, patients can come into the hospital and they can say, I'm a difficult poke, and they go ahead and call us.
I see.
Or if the nurse assesses and figures out they are difficult access, or the doctors or anybody else, they can call us and we will go in. If they've tried and missed, they only get 2 chances, and if they miss twice, they have to call us.
Gotcha.
So that's kind of the national standard.
I
So-
see. But that's part of, I guess, setting up this team when you did that, right? So that these are the rules that everyone follows at the
Right.
hospital now, and so it sounds like there's going to would have to be team members there 24/7.
We're building. We're I like to say we're small but mighty.
Okay.
So like every other new program, we kind of have started smaller. So we cover Monday through Fridays, almost for like about 10, 11 hours.
Okay.
And then we are expanding. So
Your goal would be, I guess,
our goal
to be
would
more,
be,
right?
yes,
I guess.
absolutely, to have
Okay.
somebody there all the time. So, but I think we do a lot of good things in just the hours we're there. So the nurses are great with assessing their patients, and other disciplinaries can call us and say, this patient's a hard access, so they kind of know we're leaving during the nighttime, so we set our patients up for success to have a good line throughout the night, and then we'll be there the next morning.
Right.
We do a lot of things on Mondays and Fridays because we're not there on the weekends. We do some on-call on the weekends for special cases where we'll come in.
Sure.
So yeah, and it's all about giving that patient a better experience. I mean, patients... I went to this conference once, and there was this cardiothoracic surgeon, pretty famous, did all these big procedures on celebrities, and he talked about how he would bring his patients back into after he did all these quadruple bypasses and all these amazing heart surgeries, giving them new leases on life, right? And he would bring them back in and ask them, how was your hospital stay? And they would say, oh, it was hard. And when he asked him, it wasn't the food, it wasn't his care, it wasn't the nurses, it was getting poked and poked repeatedly is what patients do not like. And so if we can minimize how many times we're poking people when they're in the hospital, we're giving them better care and better satisfaction. So,
Right.
Yeah.
Gotcha. Well, that makes sense. And certainly, as you mentioned, that it really is one of the first things that happens to a patient in many, many cases is
Right.
you get that IV line put in so that then the treatment can start, or whatever it is you need as you're being evaluated there in the emergency department or wherever you are. If you're just going in for surgery or what have you, that's one of the very first things I think that happens.
Absolutely.
And so, as you mentioned, there's a lot of other things that go into it, from infection control and things like that. And I know the hospital's really got a great program about cleanliness and some of these things. And I think everybody gets a lesson in infection control from every department almost.
Right.
And so that's an important part of this as well. But do you see it then expanding as you grow? Then obviously to
Right.
cover more shifts and things like that. That's part
Yeah,
of the plan.
so how we're expanding is there's different kinds of lines. Like when you first come in, an IV is placed in your arm. That's called a peripheral line.
Right.
We do something a little bit bigger where you can get what's called a midline. It's just a longer line that goes in your upper arm, ends at your armpit, that we can give a little bit, it stays in your arm. So if you need to go home with antibiotics, we can use that. And we also do a lot of care for central lines. So if you come into the hospital and are in a more critical condition, you might get a central line, and that line kind of travels and sits right in your heart. There's certain medications that we can't give in your arm because they're kind of caustic, and if they go into your arm, they can cause a lot of damage. So that's why we do a lot of central lines. And if we need to give you a lot of meds and you're super sick, it just gives us more access to give you a lot of meds.
Sure.
So we do a lot of care with those. We do a lot of the dressing changes. We do multiple roundings, like I said, not only to keep them clean and dry and comfortable for the patients, but as well as like look for all the signs of any kind of infection or redness, anything like that, just to really have a good monitoring system to keep patients safe.
Right.
And safety is our, one of our big things that we really want to keep patients safe. We really want to give them excellent care, and I think we do that with this team.
Sure. It sounds like it,
Yeah.
definitely, for sure. And certainly there's always the risk of a complication or something like that. So to minimize that
Right.
is probably what everyone at the hospital would like to see happen and wants to happen, and works very hard to make that not happen. So
Right.
that's really important as well. And so how long has your team been together, I guess, is my other question. How long since you
So-
proposed this to now that it's up and running, how long has that been?
So I would say about 5 years or so ago, I kind of started learning ultrasound IV and started training nurses in the hospital how to use it.
Okay.
So it wasn't an official team, but we did lots of trainings throughout the hospital to use that kind of adjunct to get patients that had difficult IV access. So our team officially started in November, where we have a dedicated team, and so it hasn't even almost a year now.
Okay.
So it's been a great thing. I mean, I really think patients, when they come into the hospital, that is one of their fears, is to have an IV or to get poked. I mean, especially kids, don't want
Sure.
have to get a poke. But, if we could do it in a way that minimizes discomfort as much as possible, it's still a needle. You still feel the poke. But everybody has their horror stories where I've been poked and poked and poked, and we don't want that to happen at San Juan Regional again. We want them to have good care and really have good experiences with coming in and not having repeated attempts.
Sure, and
So-
that makes sense to me. But,
Yeah.
but that's a big lift, I think, too, when someone's coming in and they're ill and they're just not feeling good,
Mm-hmm. Right.
and you want them to feel like they're having a good experience. That's tough because there's a lot of things outside of your control.
Right.
And I guess this is one of the things within your control that you can try to
It is.
improve upon, which maybe is why this has been accepted so quickly.
Right, and that's a big statistic, right? 90% of patients, they need an IV. So,
right.
I mean, the better care we could do for that, I mean, is a huge majority of our population coming into the hospital. So, yeah, I mean, we always want to do better at San Juan Regional. We always want to give the best. We always look into national standards and best practice acts, and we want to be at the forefront of that. And I think that this team really speaks to that. This is the future. I always say that eventually all nurses will be carrying around a handheld ultrasound to find those veins, and technology is amazing and it keeps it expanding, and we're going to be teaching nursing students to use ultrasound because it's just a great tool in our pocket, right? Instead of blind sticking and hope you get it in the vein, you'll see it and it'll be in there. So,
Right.
yeah.
Sure. And that's not every patient, though, right? Because some patients, their veins are more noticeable and more
exactly.
identifiable, I guess, when
Yes.
they come in. But there are
Yeah.
those other ones that you mentioned that are more
Right.
difficult, and that's why you would want this extra tool, the ultrasound, to help you minimize the number of pokes you're attempting,
and
right?
some veins aren't visible to the naked eye, right? You have those, I always joke that 20-year-old that's the weightlifter that comes in that has the huge ropes that you could throw an IV across the room and maybe hit. But, the people that don't have those vasculature or have chronic conditions, or, ethnicity plays a key. Sometimes the darker skin, they're harder to see their veins, as well as like people have tattoos now and trying to see veins through tattoos.
Right.
All these things, all these different people that make individuals unique, their vasculature is unique as well. So, we have to have the tools to treat them just like everybody else. Health equity is a huge thing, right, in
Sure.
our population, and we want to treat every patient the same. So having those tools to treat everybody the same and give the same care is really important to San Juan Regional as well.
Yeah,
So.
I would think so. And as you talk to your colleagues at other hospitals and things like that, is this something, having a team like this, is this something that other hospitals either already have or are talking to you about, wow, how did you do this and how can we do this at our hospital?
So it pretty much, bigger hospitals have this.
Uh-huh.
I went to a conference about 5 years ago, and really, I say I drank the Kool-Aid because I was all in. It was super important to me. We're actually, some of my team members and me are going to a conference next week, a national conference on vascular access, and it gives us all the updated, what bigger hospitals are doing, the updated standards, what we could really be following, what we really could do better for our patients here. So it is a great way to learn things things, gain knowledge, and bring all those awesome things back to our community.
Right,
So,
right. And would you be talking at this conference about things like this, like we're talking about this morning, or is there other things that are on your radar to try to improve upon or try to investigate to see maybe what other bigger hospitals are doing that you could bring here?
There's always great things. There's always great products we could bring here. There's always better techniques to do. There's always way to decrease, less sticks and less discomfort for patients. And that's kind of all what they talk about. Infection is always on the forefront, right? We don't want it to have any infection or big infection prevention.
Right.
Yeah, and also, we don't want to continue. We have a big renal population here and a big end-stage renal disease, and their lifeline sometimes is their vasculature. So we really want to preserve veins, and we really want to, even though we are putting a needle in them, we want to give the smallest IV in there. We want to not do permanent damage or scarring or make the veins stiff. So that's those are the techniques we learn and we go by, and they always talk about those at the national conferences, but we do that here as well. We really, want to preserve the veins. When people go and give plasma, donate plasma, sometimes they have very bad scars and stuff there. So we don't want patients leaving our hospital with permanent damage to their vasculature. So we do
Sure.
a lot of things to prevent that.
Got you. And I guess that's something I hadn't thought about, but if you have maybe multiple visits and need multiple IVs over time, that
Right.
could cause some damage if you're not careful. I guess that's the idea.
And absolutely, and we really try to put the smallest IV in there. When I worked ER, we used to joke, years and years ago, go big or go home. We wanted the biggest access we could get, and that is not the case anymore.
Interesting.
We want a small access that sits good in the middle of the vessel that isn't banging up around it, causing all those issues, all that scarring, all those clotting issues, all those things we can give. And IVs are amazing. Just like I said, ultrasound is amazing. Our technology with products has grown and grown. So even the products we're putting in people are light years beyond the ones we probably put in 20 years ago. They have better flow rates. We can give medications faster and safer through them. They protect the patient as well as protect us from needle sticks and all those things. So yeah, everything's growing and expanding. So.
It's amazing how quickly the technology and the research, I think, is improving medical care and being able to bring that into our hospital and others around the country, I guess, is what we're talking about.
They even have catheters now that are impregnated with antimicrobial things that help prevent infection. So we really are, trying to be at the forefront. Our hospital are using all this technology. So,
nice.
Yeah.
Very good. And you mentioned the handheld ultrasounds, which I hadn't been aware of, but I'm assuming they could get smaller in size,
They do,
right? And
just like our cell phones,
so
right?
I'm thinking they're not reeling something into a room
We use the
to do
wheel
that.
ones right now, but we do have a small one. So if we have to, sometimes we have to run across the street to our rehab hospital.
I see, sure.
It's easier to take
course.
our handheld one than to drag a wheel something across. So,
Gotcha.
Yeah, and we also have an outpatient endoscopy, and we run down the hill, and we can use that as well. So,
Okay.
yeah, technology is always growing and amazing. So.
Right, very much so, very much so. And I know we're talking about pokes and things like that, and there's a lot of research, I think, being done about how pain is interpreted by the brain, and the brain really, I think, controls a lot of these pain sensors and tells the body kind of what to think about, and so that's a whole other show. And I understand that, but I think it's fascinating kind of how some people don't mind maybe a poke, other people get very upset even before you come close to them with the needle, and it's just the way that maybe we think about these things
And I think
our
prior experiences, right?
Good
So
point.
if you've had really bad experiences with being poked, and I know, I used to work in pediatrics, and I know kids, they almost develop this trauma associated with being poked. So you don't even have to, you just have to be close to them with a needle, and they experience the trauma all over again. And some adults are just the same.
Sure.
So if we can minimize that trauma they associate with a needle poke and making it a better experience, then it won't have that fear or that increased pain response attached to it. So,
I agree with you, but I think that's amazing. And again, it's fascinating to see the studies that are coming out about that. And again, how we respond to that in the real world too, because, if someone, I'm not going to say you don't feel pain, because people do. Yes. And some people more than others, and some people just have a thing about needles, and I get that, and I think it's certainly worthy of respect to, and dealing with those types of patients, which it's got to be difficult for someone like you and your colleagues to say, we have to do this. I know you don't like it, but it's important for your care that we put this in, and I don't know how you do it.
We get a great response.
Good.
We have, our jobs are very rewarding. We get a great response because people don't like to be poked, but when you do it in a way that you get it on the first try, or if they've had multiple pokes in the past and they're like, oh, here we go again, I'm going to get poked 2, 3, 4 times, and they just get one poke, it's a great experience. And we also put IVs in places that are going to last. So that's a big deal for us too. We don't want you getting poked and right in the crick of your arm, and you keep bending and it kind of is uncomfortable and it's going to come out. So we try to put them in places that are like your forearm, that are going to last for your whole hospital stay. That is our goal. We don't want you to have to be poked and poked. So if we can get one IV to last while you're in the hospital, and it's an uphill battle. Our bodies are amazing things. They attack. That's a foreign body. They're going to start attacking the IV as soon as it's in. But if we do all the right things and follow all the right standards, like putting the right length of catheter in, putting the right size of the catheter in, putting it in the right location, right? Putting it in appropriately and antiseptically, it's going to last. And then they don't have to be poked again.
Right. Very true. I imagine for you and your team members, it's probably pretty gratifying when you do the poke and the patient is like, that wasn't as bad as I thought, or wow, I hardly felt it, or all those different things, right? And maybe they've set it up to be so negative, and yet it turns out to be a positive.
And we can distract people because we have them look at our ultrasound machine, and now it's kind of like a video game that they're watching the needle hit the target, and it's almost like a distraction. Kids, I've done it on kids, and I get them really focused on the screen, and they're like, oh, there it is, I see it, and
and it's over.
And really, involving them with their care about how you put on the dressing and how they look at it. And it really, when you get patients involved in their care, they're more apt to be on board with it. So I think that's a big thing our team really tries to do well.
Yeah, that's important. I think for a lot of folks and for a lot of patients who maybe want to know every step of the way, what are you doing next? What am I going to feel? What's going to happen next?
And communication is super important, right?
Sure.
And especially with kids, you have to speak to what age they are in.
Of course.
But adults want to know what's going on. They want to know exactly. And I feel like the more explanation they get is always better in their hospital stay. Really having that, multidisciplinary communication, and I communicate with you and the doctors communicate, is always a great thing. So
very true. That's very true. My guest this morning, Maranda Marquez, is here. She is the coordinator for the Vascular Access Team at San Juan Regional Medical Center. Been running now for almost a year, you were saying, right? So congratulations with that. And is expanding or growing, you hope, as you bring more members on and more nurses on. The idea is to add to the team and have them available more frequently, I guess, at the hospital,
Yes, absolutely.
Very good. And so what's next? Is there anything else that you're working on or thinking about for this team or others?
We just did an initiative. So central lines, as of now, were being placed. And to keep them secure, they put stitches in them to keep them secure.
Sure, because it's right in the middle of your chest, almost, right
chest
your heart,
or neck or right in your thigh. So
I see.
They were putting stitches in to keep them in. And our team made this initiative where we wanted to ditch the stitches and start using just adhesive securement devices. So less pokes to the patient, right? They're all not only getting poked for the central line, but stitches to keep it secure.
Right.
So that was a hospital initiative we did, and we're pretty proud. We just won the 2025 New Mexico Hospital Association Award for Excellence with that project, and we'll be recognized October 1st for that. So
congratulations.
We won for acute care hospital for that initiative, and really recognizing the quality care we're giving to our patients. So that's super exciting. So that's coming up. Yeah.
And so is that, and you used a term there that sounded a lot like tape, but it's probably more than just tape to secure these things to the
just
body.
an adhesive. Instead of, it's just a specialized thing that the central lines clamp into.
I see.
And then it is adhesive, so it's like tape, instead of putting those stitches in people. And,
just as effective,
yeah,
obviously.
just keeps it secure. The whole point of it is to keep it from falling out,
Right.
And so these work great. If they get put on right, they work great. And our team rounds on them to make sure they're secure, make sure they're clean. So this has been a great thing, a great project through our whole hospital that multiple people were involved with. Our ICU team was involved with, our nurse leadership, our infection control, our informatics, like gaining all the data on all the lines. We've had some great physician champions. Some of our intensivists, some of our hospitalists have really worked to make this, because it's a team project. For things to change, you have to have multiple people on board promoting it and advocating for it. And we did. We still get the few sutures that are in there, but we're getting less and less. So we're really proud of that. And we don't want any central line infections at our hospital. And this is a proven method of decreasing that. So.
Nice.
Yeah.
Very good. Well, it's great to learn about all these things that are happening at the San Regional Medical Center, and how an employee can come up with an idea and a suggestion and have it move up through kind of all the levels to kind of check on it from all different sides, I guess, right, to make sure it's feasible and
I feel very
workable.
lucky. I've been, like I said, I've been at San Juan Regional for 20 years now, and I really feel like they listen to you. They really want the best care for your patients. And if you have an idea that's going to give exceptional patient care, they really support you in that. I know I talked to you last radio show about our nurse residency program.
Right.
That is also another initiative we kind of all started to give better education for our nurses. And San Juan Regional, really saw the value in that and retaining our nurses. So it's nice to work for a community hospital, honestly, because if I worked for a huge corporate, I'd have to go through all these other hoops. I mean, everybody lives in our community, everybody grows in our community, in our hospital that works and leads our hospital. So it's nice to have that, and they see these initiatives and embrace them and really know what it's going to give to our patient population.
Right.
So,
Very true. And of course, here at San Juan College, we were excited about the new agreement for more nurses.
Yes, absolutely.
And bigger nursing program to get maybe more nurses into the hospital. And so, because we know that the need is great. So it really is part of the community. So that's wonderful.
Yeah.
We're out of time. I'm sorry to say.
Oh, no. Thank you.
Thank you for coming in.
Yes.
Always great to visit with you and
You
learn
too.
about the work that you do at the hospital with you and your colleagues, and appreciate your time this morning.
No, I appreciate your time letting me speak about vascular access. Thank
That's
you.
true. Very,
all right.
Very interesting. Thanks for coming
Thank
in. You bet. My guest this morning from San Juan Regional Medical Center with me here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.